In a clinical setting, you're also going to have to take into account what levels of decontamination are appropriate for that setting, that environment. Yeah, like I said in a previous lecture, it would be great if you could go through, every room, every hallway, every floor in a hospital and completely sterilize. But the amount of money, the amount of work that would take to, one, initially do, and two, to maintain is ludicrous. So you have to sit there and determine what levels of decontamination are necessary. Levels are going to be in the surgical wing, places where the patient's going to be opened up and anything in the environment may get in them. So you're going to want to have stuff that's not only going to kill vegetative cells, but things that are going to kill, destroy endospores. The level of decontamination here is going to be coming close to sterilization of the environment. Now, a lot of the new electronics, gear that we have in the surgical rooms that are monitoring the patients, you can't heat them, you can't sterilize them, but you can decontaminate the surface with different chemicals to the point that nothing's going to come off of those and nothing's going, that's going to expose the patient to something that could be damaging to it. So the level of decontamination that's these rooms are going to be high, not quite, but coming close to sterile. A lot of times they're going to use what are referred to as sterilants, things that, could, given enough time or a little bit higher concentration, could sterilize the room. But, again, that's going to be a little cost prohibitive. Then there's going to be high and then a little bit lower. It's going to be the intermediate level. You're going to want to kill fungal spores. You want to kill bacterial cells, vegetative cells, and viruses, but you're not going to worry so much about bacterial endospores. These are going to be examination rooms. Some level of surgical rooms that that you're not going to being high extreme surgeries in. And then below the intermediate, high, intermediate, low. This is going to be waiting rooms. This is going to be prep rooms, things like that. Screening rooms where there's going to be such a high traffic of people in and out that keeping an intermediate or high level of decontamination going to be a little too difficult. But by, at least maintaining a low level where you're removing most vegetative cells, you're not going to be damaging fungal, you're not going to be anything to do with, the endospores. This is spray down and wipe. Different areas within the clinical setting, different areas within a hospital, restaurant, whatever, are going to require different levels of decontamination. What level you need will dictate what chemical, what compound you will use.